Welcome to Nursing Exam, Q&A. We are going over Nursing Pearson 3rd edition, Volume 1 and 2. Nursing, a concept-based approach to learning Volume 1 and 2, Pearson. 1. A client is brought to the emergency department after passing out in a local department store. The client has been fasting and has ketones in the urine. Which acid-base imbalance would the nurse expect to assess in this client? A. Metabolic acidosis. B. Respiratory alkalosis. C. Metabolic alkalosis. D. Respiratory acidosis. 1. Answer: A. Metabolic acidosis. Rationals: a client who is fasting is at risk for development of metabolic acidosis. The body recognizes fasting as starvation and begins to metabolize its own fatty acids into ketones, which are metabolic acids. Starvation would not result in respiratory acidosis or alkalosis or in metabolic alkalosis. 2. Which risk factors exhibited by the client, presenting in the emergency department, would place the client at risk for metabolic acidosis? Select all that apply. A. Abdominal fistulas. B. Chronic obstructive pulmonary disease. C. Pneumonia. D. Acute renal failure. E. Hypovolemic shock. 2. Answer: A, D, E are correct. Rationals: metabolic acidosis is rarely a primary disorder. It usually develops during the course of another disease, presence of abdominal fistulas, which can cause excess bicarbonate loss, acute renal failure, and hypovolemic shock. Chronic obstructive pulmonary disease and pneumonia place the client at risk for respiratory acidosis with the increased retention of carbon dioxide in the blood. 3. A child with acute asthma has a CO2 of 48 mm of mercury, a pH of 7.31, and a normal HCO3 blood gas value. The nurse interprets these findings as indicative of which condition? A. Metabolic acidosis. B. Respiratory alkalosis. C. Respiratory acidosis. D. Metabolic alkalosis. 3. Answer: C. Respiratory acidosis. Explanation: if the pH is decreased and the CO2 is increased with a normal HCO3, it is uncompensated respiratory acidosis. Uncompensated respiratory alkalosis has an increased pH, decreased CO2, and normal HCO3. Uncompensated metabolic acidosis has a decreased pH, normal CO2, and decreased HCO3. Uncompensated metabolic alkalosis has an increased pH, normal CO2, and increased HCO3. 4. The nurse is reviewing the latest arterial blood gas results for a client with metabolic alkalosis. Which result indicates that the metabolic alkalosis is compensated? A. pH 7.32. B. PaCO2, 18 mm of mercury. C. HCO3, 8 milliequivalent per liter. D. PaCO2, 48 mm of mercury. 4. Answer: D. Explanation: a normal pH level is 7.35 to 7.45. A pH of less than 7.35 is acidosis. PaCO2 level of 18 mm of mercury is low and is seen in respiratory alkalosis. HCO3 level of 8 milliequivalent per liter is low and is most likely associated with metabolic acidosis. In metabolic alkalosis, there is an excess of bicarbonate. To compensate for this imbalance, the rate and depth of respirations decrease, leading to retention of carbon dioxide. The PaCO2 will be elevated. 5. A client has been admitted with chronic obstructive pulmonary disease. Diagnostic tests have been ordered. Which of the tests will provide the most accurate indicator of the client's acid-base balance? A. Arterial blood gases, ABGs. B. Pulse oximetry. C. Sputum studies. D. Bronchoscopy. 5. Answer A. Explanation: ABGs are done to assess alterations in acid-base balance caused by respiratory disorders, metabolic disorders, or both. A bronchoscopy provides visualization of internal respiratory structures. Sputum studies can provide specific information about bacterial organisms. Pulse oximetry is a non-invasive test that evaluates the oxygen saturation level of blood.